Look out, it's the July effect. The July effect is in the house. I have talked about this phenomena for the past several years, and I posted a put up a post on Instagram to talk about this particular phenomenon and how I feel about it. I gotta admit, you know, it's an interesting change. First of all, the July effect. The July effect is July 1st every year, physician residents start their residency. So physician resident interns start their first day from medical school, and they're starting their first day as residency. They have zero experience, and they are given the responsibility of starting to care for patients. Let you just imagine how well that goes. So this time of the year, there's this perceived notion that you should stay away from the hospital. Don't be a patient in the hospital. There's perceived increases in error in the hospital because of these baby doctors. It's created a buzz on the internet every year. Everybody in every walk of life in healthcare starts making fun of the July 1st effect. And nurses are just as guilty. And I was just as guilty when I was a bedside nurse. My opinion changed greatly when I became a nurse practitioner, when I went through NP school and currently practicing as an acute care NP in an ICU, in a multiple disciplined ICU. I work shoulder to shoulder with residents, attendings, fellows, and I have a much greater appreciation for their learning process. I have much more respect for what they have to know and what they have to go through. And I was one of those unfortunate nurses that like to make fun of them because in their intern year, they truly don't know anything. But who does when you're new? Yet, we have somehow begun to chastise them and make them the butt end of our jokes. Instead of embracing them, instead of educating them, instead of helping them, we're performing the worst of all things, what you would call lateral violence. I mean, we're bullying them. Whether it's direct or indirect, we're still doing it, which is kind of discomforting to me. It's all fun and games until someone is affected on a level that you weren't expecting. Being an intern is super hard. Not only are you brand new to your role, but you got to learn just about everything there is to know about everything. So I often wonder if we realize that we're treating these interns horribly. That whether we're doing it aggressively, whether we're doing it indirectly, it's our job to try and help them, because in the end, it's all about the patient care that we're going to provide, and they're part of that. You ever wonder that, you know, we treat them like this and make fun of them for not knowing something because they're the new person? How would you feel if that was a new nurse and they were getting that type of treatment? How would you feel? Would you accept it? Would you jump in on the party and make fun of that nurse? Because that's what we used to do. It's what we used to call nurses eating their young. I don't know about you, but if there was a new nurse out there who's learning the ropes and learning their job, and someone starts to make fun of them, I'm going to defend the nurse. I'm going to defend that new nurse, because that new learner needs time. Yet we don't treat our residents that way. The first experience that these residents are having about nurses is completely negative. They're interpreting nurses as they're bullies, they're not helping, they're overpowering, they're know-it-alls. Instead of them learning that we're team players, we're collaborators, and that we've been there, and that we want the patient to be cared for in the best possible way, and you're part of that. So let's figure this out. We all have a role to play. Let's figure out how we can meet our goal, which is taking care of our patients. Instead, these residents are developing coping mechanisms that interpret nurses as the enemy, or interpret nurses as, though they're the ones that always made fun of me. So then when they grow up from being a baby doctor to being attending, those feelings stay with them. Their first interpretation of a nurse carries on with them until they're an attending. And then nurses get surprised when these nurses return the favor. They get surprised when these attendings return the favor to the nurse and treat them the way that they were treated when they were interns. More bullying, more lateral violence. So do you ever wonder if this July effect that we're ha-ha-haing about is one of the catalysts for the lateral violence that we nurses suffer on a daily basis? Am I saying that it's going to move worlds and it's going to change things on a massive level? No, but we got to start somewhere, and this is one of those things that we can change. It's easy to change. We have to remember everybody starts somewhere. Everybody starts new. How did you do when you were new? How much did you know when you were new? Fairly certain you appreciated all the help you could get from all services and all walks of life. Don't you think it's time we put to rest this July effect and start treating these interns, these residents, first year, second year, all up to the fourth year, regardless of how they treat you, you need to treat them with as much positivity and respect as you can give, because hate just begets more hate. Negativity just gives more negativity. If they want to be that typical doc that is going to have the God complex, then that's their loss. It's our job as a profession to rise above. Is it easy? No. But I think we all can do it. I think the next time that you see a nurse, a resident, a physician intern of any kind, you need to approach them and collaborate with them and talk through whatever problem you have going on so that you can both reach the ultimate goal of taking care of your patient. It's not about who's right or wrong, who's better or worse, who's smarter or not, who has more training or not, who's in charge or not. It has everything to do with the patient. Take care of your patient and you'll both win.